Well, welcome. I'm very excited today to bring this group of people together for you because Life's Co-Pilot, our whole purpose is to try to bring information to seniors, their family, their caregivers, to try to guide you through all these scary things that you're like, what do I do and how do I find these resources? And I guess I'll tell this story. It's why Life's Co-Pilot originally existed is I was so frustrated dealing with trying to find these resources myself, trying to navigate from family members over more than a decade. And then I got involved in the senior world, started meeting all these people, and then I saw a article in the media where a senior couple committed suicide because they just were overwhelmed with not knowing how they were going to fund things and whatever. And I realized we don't have a lack of resources. We don't have a lack of services. We have a lack of knowledge they exist and how to access them. And today we've got free resources, people that can be there for you to help you do stuff. So I'm very excited to bring this team together for you here. And I'm just going to let you guys kind of introduce yourselves. Theresa, on my screen right now, you're the one that's up large on my screen. So I'll let you introduce yourself. Who are you? What is your organization and what do you do? Your mic is off.
Hold on. Thank you. Thanks for having me. I'm Theresa Patterson. I'm the Executive Director of Gennesaret Free Clinics. Gennesaret Free Clinics is a Indianapolis-based organization, and we have 4 separate service lines. So we provide free medical clinics, a free dental clinic. We provide health respite homes for individuals experiencing homelessness, post-hospitalization, and we have a women's health services program designed to help women of color drive down disparate health outcomes when diagnosed with breast and cervical cancer.
Excellent. Dustin.
Hello, thanks, Jim, for this opportunity. My name is Dustin Ziegler. I'm Vice President of Clinical Integration at SECOA. And SECOA is the Central Indiana Area Agency on Aging, serving Marion County and the surrounding counties, so 8 in total. We do a tremendous amount. Our work is large in scope. Overall, our aim is to provide the resources, the services, and the supports that older adults, actually anybody of any age who has a disability, and their caregivers, providing them what they need to remain at home, independent, and in optimal health for as long as possible, as opposed to institutionalized care like a nursing home setting. So a large majority of our clients that we serve have a level of care that's eligible to be placed in a facility, and through interventions that SECOA provides, on average, we're able to keep those folks at home for over 3 years where they want to be, with usually better care and at lower costs. So that's our aim, and happy to be here and excited to learn more.
Excellent. Thank you very much. Kim, I'm just kind of going across what I see on my screen here. So Kim, introduce yourself and who you are and what you guys do.
Thank you, Jim. I'm Kim Williams with the Indiana Parkinson Foundation, and our foundation offers programs and services for those with Parkinson's and their families. So what we provide is exercise programs, support systems, and educational opportunities for these people so that they have the tools that they need to live their best lives with Parkinson's, and connecting them with great resources in their communities that they need along the way. Most of our services are free. Our exercise program does have a cost, but we do not turn anyone away. If they have a financial hardship, we are happy to provide scholarships. And we have found that people start with us for one of our programs and end up in the others. And they return for the community that's provided, the people that they come alongside and learn from each other, just as well as the resources we connect them to. So I'm very excited to be here and learn more about additional resources in our community, like Madison and Theresa's organizations. So thank you for the opportunity.
Excellent. Speaking of Madison, we'll go ahead and go to you next. So tell us who you are and what your organization is and does.
Perfect. I'm Madison Gonzalez. I'm the Executive Director of Morning Light. Again, I'm really happy to be amongst this panel, seeing all the good that the community is doing for the seniors. I think, like you said, Jim, seniors are one of those populations that just shouldn't be forgotten. And unfortunately, a lot of that information is kind of buried for them. So at Morning Light, we operate the Abby Hunt Bryce home. We believe that everyone deserves care and dignity at the end of their life, regardless of background or income or means. So we operate a hospice home. So you can imagine how scary it would be to be diagnosed, terminal or be on hospice. But then our residents are also homeless. So they might not have a suitable living environment. It might not be clean. It might not be safe. They might not have people, around the clock to care for them in the way that a terminal individual would need. So we developed a hybrid model. We partner with hospices, hospitals, and healthcare professionals in Indianapolis, and we are the home. So we have a 12-bedroom home. People come and they stay with us for free, and we provide a room. We provide 3 home-cooked meals a day. We provide, a hand to hold so that nobody has to die alone, all at no cost to our residents. And we really believe that, our residents don't come to die, they come to live the rest of their life, and we try to make that as comfortable and dignified as possible.
Excellent. Maria, tell us about who you are and what your organization.
Thank you, Jim. Yes, so my name's Maria Holmes, and I'm a licensed clinical social worker. I'm a senior manager for care and support at the Alzheimer's Association. So we're a nonprofit. Whilst we do sort of a variety of things on the research front, we are very concerned for families that are dealing with any type of dementia, whether it's Alzheimer's disease or any other type of dementia. And we have a selection of free programs for them. So our number one go-to is our 24/7 helpline. So even over the holidays, no matter what, and no matter what time of day, there is always somebody at the end of the phone. So if anyone's having any concerns, and it could be the person with a diagnosis, or it can be a family member, there's always someone to discuss concerns and hopefully get some tips. We also provide free support groups. We have trained volunteers around the state that provide support groups, generally monthly, where people can get some ongoing support and encouragement and tips from fellow caregivers. And then we have a range of education programs that we have pre-recorded on our website, but also we provide that in local communities as well. And I mean, ultimately, our goal is to try to, I think it's exactly what you said, Jim, people don't know about these resources. And we know that we're only hitting a very few of the 110,000 people that are dealing with dementia in Indiana. So our goal is to reach more people, get the word out so that they know that they're not alone and that there's these free resources. And I will also, I also offer care consultation, sort of more my social work piece, where I'll meet with families at any stage of the journey, just to help navigate what they need and point them in the right direction for services.
Well, excellent. Now you brought up a very good point there. You were talking about just hitting a surface on the people that are needing. I think my first meeting I had at Alzheimer's Association with, I think it was Julie Moore, and she was telling me that you guys were serving about 6,000 people of the 110,000 that in the state that you're trying to reach. And so I think that's probably something that all of you probably could attest to, is being a challenge on getting people to understand you are there for them. I know you're doing, I see Alzheimer's ads and stuff on things. What is the biggest holdback you think to get people to understand that you're there and what's there for them?
That's a really interesting question. We know that we serve people that know how to pick up the phone and the questions to ask. And it tends to be not people necessarily from, our diverse communities. So we have a real need to reach out to those folks who are balancing so many balls in the air. And it's when you are coping with all sorts of things, it's hard to make that first phone call. It sort of tends to have to be a crisis before anyone will reach out for help, because there's a sense that you've got to manage, you've got to cope, and keep moving forward. and so sometimes that first phone call can be, and that may be all that's needed. It may be just one phone call that will just, give them some doors to open. So yeah, it's a challenge when people are just in the midst of dealing with what they're dealing with and not knowing where to go. Yeah.
I just like, now, do you think that, I know that you guys, Alzheimer's Association, but you deal with all different kinds of dementia and things like that as well, do you not?
Yes, we do. So obviously, we always talk about that dementia being the umbrella term, and that's evolving, results in some cognitive decline, and it's impacting day-to-day life. And Alzheimer's disease is the most prevalent one, but there are all these others. There's lots and lots of them. There's very sort of more common ones. But yes, sometimes I think the name of our organization can be a bit off-putting sometimes, because people just think, oh, that's Alzheimer's disease. My loved one's got dementia, so that's not Alzheimer's disease, so it can be confusing. But yes, we do deal with anybody, and then at any point in the journey as well. So sometimes we get a lot of people just initially, they've just been diagnosed, that they want to know what to do, what to plan, and that's wonderful, because we love to get people early on, because we can really put them in the right direction. But we'll equally deal with people that are making some very difficult decisions or looking for resources. Maybe I'm constantly referring to SECOA, because people are looking to maybe see if they're eligible for some home care and or meals or transport. So a lot of our work is really directing people to other resources in the community.
Well, very good. Madison, I think pretty much the same question. I mean, now you have a situation where you have a finite amount of people you can help at any given time, I would imagine. But how do people know of you? I will tell you how I found out about you. I bumped across your predecessor at a like a fair thing that he was handing out pamphlets, and his table was next to my table. But I don't know that I would have heard of you had it not been for that. So how do you guys get that word out?
Well, this is always kind of the challenge, right? Is that, nobody knows what we do. And I think a lot of nonprofits feel that way, and a lot of the time when I do tell people that we exist, people are like, I had no idea. And then that always makes my heart sink, because I'm like, oh, these are people that need to know. So what we've really tried to do, we actually have a position on our staff that's just a referral specialist. Which is their sole purpose is to go out and educate the community and the hospice teams that we work with, so that if they do, if someone goes to a hospice agency or goes to a hospital and needs our services, they can just direct them to us. So we have a great referral pipeline now. It's funny, for a couple of years after the Abby Hunt Bryce home was open, there would be just one or two people in the home at a time, and we have 12 rooms. And we said, this is a problem. What? We have this free home, our service is free. Why do we only have a few people? And it was really a matter of education. And so I think a problem that we run into when it comes to hospice and dying is that it's so stigmatized. I think people are afraid of it, so they don't want to have those conversations. I think, American culture, death is something that's a bit taboo. We don't talk about it a lot, and we wait until, it's time to educate ourselves, until it's already upon us, instead of trying to learn about these resources ahead of time. As Maria was saying, it's nice to get someone early, because then I think we can help them for longer, which isn't always the case. So what we've really tried to do is panels like this, going into, like I spoke at a lifespan development class yesterday at Butler, and these are college students who shouldn't have to worry about hospice for years and years, but they might have a grandparent who's needing it. They might have a parent who's needing it, and just trying to get people more comfortable with the conversation of end of life, and that, it's something that we're all going to face at one point or another, and just destigmatizing some of those things, because I think when people are informed, it can be a little less scary, right? I think a lot of the time it's such a scary topic because we just don't know, and we're afraid of the unknown. And so that's really what we try to do. We try to find different platforms to speak about hospice, and we just try to get people comfortable with the conversation. Once they're comfortable with the conversation, then we can start to help them.
That's one of the reasons that this platform exists, is because I was dumbfounded when I found out what hospice was. I thought it was a morphine drip. Okay.
Mhm.
That was kind of what I thought. My father would have benefited tremendously had I known what it really was. And the best I ever had anybody explain it to me is curative medicine. Doctors are trained to cure, so they're always trying to find that thing to cure. And if you've got a incurable situation, that can almost be torture, okay, to keep trying
Exactly.
to cure something.
Exactly.
Whereas hospice, rather than trying to treat the cause, is treating the symptoms so that you're comfortable, you're not in pain, you're eating better, you're hydrating better, you're sleeping better. And so all of a sudden you're feeling better. Maybe you can live a longer life and do things, but most people don't think of hospice in those terms.
Exactly. I think a lot of people think it's giving up, and that's
Mhm.
why it's scary for them. And really what it is people just saying, you know what, I'm accepting the situation and the reality that I'm at, and then I want to be as comfortable as possible with that. So it's, I don't want to fight anymore. I don't want chemo anymore. I don't want to be sick anymore. I don't want to be battling this illness anymore. I'm accepting where I'm at, and then let's just make it comfortable and know that, there's only a certain amount of time left, but let's make it as comfortable, peaceful, and enjoyable as possible so that the end of life can be a good one. So that's exactly right. I think a lot of people don't like the word hospice because it means, okay, it's accepting that your life is near an end, but at least you're able to have as good of an experience as you can for those remaining months.
Well, and the thing is, what I have learned is there's a thing graduating off hospice. I didn't know such a thing existed, that people get to feeling better and then all of a sudden they're off,
Well, it's amazing. We see that in our home sometimes. People will come and they'll say, hey, they've only got a couple of weeks to live. But when you have a suitable living environment and you're surrounded by comfort and love and getting the food that you need and getting the care that you need, we've sent people home. They're dropped from hospice. And I don't mean to say that we cure people, that doesn't always happen.
Right.
But that's exactly right. It's amazing what happens when people are just put in a good environment.
Kim, I assume you probably have similar issues at the Parkinson's things. What are you running into on that whole process?
Absolutely. There's too many times that I get the phone call, I wish I knew about you 6 months ago. And it just breaks my heart every time I hear it. And like all of these people on the panel, we think that we're doing all that we can to get our information out there so people know we're there, and we still get these phone calls. I am very diligent in the social media area, the website presence, the newsletters. But ultimately, I think it's a matter of educating our healthcare providers, the doctors that are seeing these people, and making sure when they make this diagnosis of whatever it might be, Parkinson's, whatever it might be, if it's a life altering situation, diagnosis, whatnot, they need to be able to say, or they need to have the nurse practitioner there to educate these patients and say, these are your resources, instead of just saying, here's your medication prescription. Give them the other things that they need. And I know the doctors are overwhelmed and they have so many patients and they don't have time, but it's almost like, gosh, there's 911 when there's an emergency, there's 211, but I feel like so many people don't know about. And it's also overwhelming, right? So I feel like we have to figure out something to bridge this gap, because, oh my gosh, like two of these people, Madison and Theresa, I had never heard of. And I'm like, I need to be talking with both of them, right? I need to be, educated on what they do, because I feel like we could, really help each other. So yeah, I don't know what the magic answer is, but I truly see the gap, and we're doing so much to get our name out there and the information. And I feel like if we could just get the people that are seeing these people firsthand for the medical care, if they had the tools to share with their patients, that would be a huge help.
I was thinking, and it just was thinking as we've been discussing this today, Alzheimer's Association and Parkinson's Foundation. I think a lot of the advertising that goes out is fundraising, okay, and I think that sometimes you could possibly get. I'm not sure the population can't think that well, they're doing research. They're not really here for me, so that's the thing that I just was thinking that could be a reason that the phone doesn't, 6,000 out of 110. We got to figure out how to get that number up. That's what I'm, those are the things I'm trying to figure out, so, and this literally was a thought as we were having this conversation. Do people think that it's a research organization, or, rather than so much, something that can help me in my daily life, so Socoa, you guys are the kind of a big fish in the playing field here. Everything you're kind of like the hub that everything spokes off of here. Okay. So tell me about, I'm sure you're seeing the same circumstances.
Yeah, that theme is very prevalent. To build on to what everybody's already mentioned, I've had 3 career positions: hospice, Alzheimer's Association, Socoa. All 3 of them has been the same pattern of, we wish we would have known about you so much sooner, and the trajectory it would have made in their health and wellness and independence had they known that. So yeah, I would identify education gap and awareness as the biggest issue surrounding all of this. I think it's multifactorial, but kind of to Kim's point, one of my biggest roles is working with the health and hospital systems. When we think of Socoa and the work that we do, if you're familiar with the term social determinants of health, 80% of health outcomes are associated with the non-medical social determinants of health that go on outside the clinical setting. So when you think about transportation, nutrition, caregiver support, do you have heat in the winter and cool air in the summer? All these different things that go on outside the doctor's office, in the home, and in the community. That's what Socoa does. And we're 80% of that health outcome. But very few are aware of the full extent of exactly what Socoa does, who we are. And so chipping away at the clinical side of things, building relationships with hospital systems, health systems, clinical providers, because in our view, they are a crucial, if not the most crucial connector to the resources in the community that folks need to optimize their health. Families, patients rely on their clinical providers to help them know where to navigate, not always just from the medication that they prescribe, but what are the other things that are going to help improve my health, my wellness, and independence that are out there. And experience can tell you, I have yet to talk to any hospital executive, any physician, anybody who has ever fully been aware of exactly what Socoa does, who we are, and what that means to them as providers in the health outcomes of the older adult patients they treat, which, by the way, happen to be now the largest, most expensive, most complex, and most vulnerable patient population that's only getting bigger and bigger. So a big focus for us is the health and hospital system. When it comes to awareness, we can see ourselves as a genuine healthcare partner. And community medicine is only going to continue to drive healthcare going forward. The population is way too large. The acuity is way too complex for health systems to be able to do this on their own anymore. It's going to have to be an integrative approach between clinical and the support systems of these community-based organizations that are all here today. That's the only way we're going to meet this huge glacier of this aging population, going forward. So I also think, to another point where everybody has mentioned is stigma a little bit. We talk about dementia. Socoa is an administrator for a program called Dementia Friends Indiana. So we work closely with the Alzheimer's Association. And that's, in a nutshell, that's what Dementia Friends tries to do, is get better education out there and break down those stigmas so that people are fully informed and aware of what dementia is, and also what it's not, so that they are maybe just a little less fearful to be able to, to want to go seek answers or get a workup because of some cognitive impairments that they may be feeling. Because now they learn, dementia it's not fun, it's not great, but it's not the end either. You can still live a fulfilled, long life, remain engaged in your community, which actually, as evidence is showing, is one of the best quote unquote treatments we can do for this condition has nothing to do with medicine. It has to do with remaining social, engaged, and active. With that, we use that to break down the stigma to get people connected, quicker to the resources that they need. But there's still a large uphill battle, and not to ding our great state, but for many years in a row now, Indiana has been drop dead last, and by last I mean in one report 51st in the nation, and in another report 53rd in the nation for long-term home and community-based services and supports. And that's reflected in our health outcomes as well. When you look at health outcomes in Indiana for this age population, and then you correlate it to the investment and the resources that keep folks in this population healthy, there's a big disparity there. So a lot of work to be done on that end. We can say, though, one optimistic area, which is going to be a significant change in our state, but Indiana is moving to a managed care model for home and community-based services, which, if you're familiar with that, basically means that providers and those delivering services will no longer be reimbursed just for billing something that they did. There's going to have to be positive outcomes associated with what we do to get billed. So no longer is it's very similar to value-based care in the health systems. The incentive is no longer just to send for x-rays and everything else, and who cares if they get readmitted because we get to bill for that. Now they're reimbursed.
I lost you.
I'm sorry.
You sound a little...
Now their reimbursement depends on keeping them out of their hospital. And now they're measured on keeping their patients as healthy as can be. And that's the direction that Indiana is going with home and community-based services as well. So I think that's the right move. It's going to be a monumental change, but I think the right one. So a lot on the forefront, despite the fact that we got a lot of work to do.
And by the way, you mentioned Dementia Friends. I'm going to brag on you for just a minute. You've kind of put Indiana, on the map with Dementia Friends, and have had some. I know that you're getting national recognition for what you've done in here with like the hospitals and with fire departments and things like that. I did the bragging. Now tell me what all you guys have got done. So
sure, yeah. Well, and it's so important. And to be honest with you, we started Dementia Friends, the movement, in 2017, and never in my wildest dreams. I mean, I would have told you you're insane if you think that we're going to have the level of success that we've actually had in the 4 years that we've had it. But it's pretty simple in nature. Again, it's just about, creating education and awareness about the condition, but then also being tasked then to do something about it. So what are you going to do to make your community more dementia friendly, or to spread the word, get more people connected? And so within that realm, we've had a lot of success that was never expected to get to this level. So you mentioned first responders. Through Indiana Department of Homeland Security, there's first responder education on dementia, to where all first responders in Indiana at least get the basics in the intro to dementia and a better perspective. Health and hospital systems adopting these practices. We had most recently had a significant achievement with providing a Dementia Friends Indiana info session to all first-year medical school residents through Indiana University School of Medicine. And that was met with such enthusiasm that there's actually lobbying to try to get Dementia Friends these info sessions as a part of the required curriculum, first-year medical students. And if you're familiar with how that works, that is impossible. The bureaucratic nature of medical schools and everything to get anything changed or added is an intense process, and usually one that's not received very well. But what we're really excited about when it comes to particularly, this example of the first-year medical students is, because they're first year and they're so early, through Dementia Friends and its messaging of being positive and there's a person behind the condition, these future practicing physicians are going to be met with a foundation of how to approach somebody in the clinic and their caregiver about this condition before they learn about pathology or pharmacology or anything like that. They're going to understand that the best treatment right now that I can do is connect them to the education resources and support that they need, like through the Alzheimer's Association and other programs. And that medication is only a very, very small fraction of that. they're going to have a better perspective of what the dyad, the person with the condition, and their caregiver is going through with this condition. It's just a really huge moment for it. We hear a lot of not necessarily positive stories about people's experience when trying to get a diagnosis, or how they were met with the diagnosis. And so we're hoping just through these little interventions and changes in mindset, that it actually can change the state of healthcare when it comes to this condition. And so that the IU School of Medicine opportunity is a big first movement for that. And because of the success of that, it's kind of snowballing into IU School of Nursing, IU School of Social Work, and recently the Indiana University Clinical Affairs Committee, which consists of the deans of all health sciences across the state in Indiana University, including dentistry and you name it, are looking to do the same. So it's a really monumental momentum opportunity to change the trajectory of how we just simply treat and engage and perceive people with this condition.
Very good. Well, I just wanted to get that out there because you guys are doing some amazing things, and I know that a lot of people around the country are paying attention. So this is very good. And I was going to say, I also tied into the Dementia Friends. When I became a Dementia Friend, took the class. One of the things I want to go back to, Madison, you were talking about, teaching at a college and explaining all this stuff. Well, statistically, from what I'm understanding, 1 in 6 millennials is a caregiver for a family member, and I was doing some research on caregiving in general. 1 in 3 households has someone caring for someone in that household, be it a senior or not, there's someone that has special needs that they're caring for. So that's pretty much, every other house, in your neighborhood has somebody going on. So this is a big need, so Theresa, I had no idea about you until someone turned me on to you guys. I did, completely missed my radar. So tell me, I'm sure you guys are having the same thing. Am I the only one that didn't know about you, or do you have other people or how are you getting people to know that you're there for them?
Great question. So we have a new director of development. He's been with us for about 6 months, and he likes to say we're the best kept secret in Indianapolis. And we're working really hard to overcome that by a really concerted effort on marketing. So marketing to, our donors and our constituents, our supporters, but really also marketing to our patients and our partners. So we have made a big effort with our website and our rebranding. You may see Gennesaret Free Clinics on a bus wrap. You may see us on a billboard. Madison and her group has been on the radio doing some work there, and that's something that we're looking at as well. So I would say the majority of our patients find out about us when they, just like the rest of our organizations, when they get to a crisis point. So they've got a tooth that's gone bad and they're in dreadful pain. They know they have a health condition that needs immediate treatment, and they're broke. And so they go to the Googles and they Google free medical care, free dental care. And thankfully, we're one of the first organizations that pops up. There are a couple of others in the city, but thankfully, we're also very interconnected with those organizations as well. So our intention is that no one goes without care if they reach out to us. So if we can't do it, we're working to figure out who can do it. And my team has been incredible this past year in breaking down barriers and eliminating dead ends and serving as fierce advocates for patients that reach out to us. All of our services are free. We try to be as no barrier as possible. And we have been incredibly intentional about creating a referral network that goes beyond what we're able to do. So we really do see ourselves, especially in the last couple of months, we really see ourselves as the doorway into healthcare for people that can't figure out how to access it on their own. And you think, oh my gosh, there's all these organizations, look at all of us, all of us doing all this work. But we're really taking the care to the streets, and we're taking it very intentionally to the people. And not just driving a mobile medical clinic down the road, the sign waving out that says free. We're using data to tell us where we should be delivering those services. So working with some pretty smart folks that understand life expectancy data and social determinants of health and how all that feeds into understanding where the pockets of our need are. So our mobile medical clinic is going to be out every day of the week. We were supported by a wonderful grant from IU Health. We were able to hire a driver, and we are hitting the streets. And again, doorway into healthcare. So we anticipate that our patients will come to us on the streets as they have proven that they want to do here more recently than even coming to our stationary clinics. But we can do a limited amount of things on the street, right? So our intention is to funnel them to our stationary clinics, which are in partner organizations. We don't have any freestanding clinics. I'm not a CVS, I'm not a Walgreens. I have medical clinics that are inside food pantries, they're inside churches, they're inside neighborhood centers. So we'll meet people on the street and then funnel them into our medical clinics. And then, as I said, we have a very intentional network of referral partners. So we know all the FQHCs in town. We really are kind of going a little bit beyond that, so that we are not just handing someone a piece of paper and say, go and set up an appointment. We're developing relationships with each of the referral partners so that we're keeping track of whether or not our patients are going to our referral partner locations and whether or not they're having a good experience. A good example of that is that we had a patient that we referred to one of our partners, who shall remain unnamed. And we followed up with them a couple of weeks later to say, did you go, first of all, and how was it? And they were mad. They were mad at us because we referred them there. They had gone and they had seen a provider and had a good visit, but they were given a prescription. And when they took it to the pharmacy, it was $500. I mean, we had somebody that was there on a sliding fee scale. They probably paid $5 to go to the clinic. So now that patient is mad at Gennesaret. They no longer, their trust is broken. They're mad at that clinic. They are not going for their follow-up visit. And the thing that saved us there is that we have a referral follow-up policy, and we called and we were able to get in and intervene. So we were able to figure out what went wrong in that setup and keep our thumb on the pulse of making sure that patient was cared for. So I guess I think your question was more about how do people find out about us? They Google us because we're free.
Right.
And we are trying to do a better job of getting the word out about Gennesaret. Gennesaret's been around for 33 years. Our founder is still our board chair. And when he started the organization, he was prominently in the paper, the Indianapolis Star, quite a bit, and that's how people took their news, right? So we were well known, but we haven't done a good job of keeping up with the time. So we're playing some catch up with getting better at Facebook and Instagram and Twitter and those kind of things, and really trying to drive our messaging out to younger people. So as Madison said, we do speak to students. We do try to recruit students to come in and volunteer in our clinics, but that's all an intention to just kind of grow our awareness base. We're actually trying to be pretty deliberate about our, from the top down. So trying to look for some younger board level support so that we can really push, it's generational messaging, right? We've got a lot of older supporters and a lot of older people that are well aware of Gennesaret, and we have to do a better job of bringing that level of awareness to the new younger generations.
One of the things I was thinking about too, I think this would go with Maria, Kim, and Dustin, all of you guys. You're these large organizations that are covering, large areas of tracts of geographically or what have you. When someone calls you, I think that there may be some intimidation about calling because they don't even know they don't even know what to ask necessarily. How do you, and I'll let all three of you, whoever wants to do it, how do you basically recommend someone would call and to get their information, how to take some of the fear away, I guess is a way of doing it. I know that one of the things we're doing on Life's Copilot, and that's when we need to get yours done on this, but we do like a introductory video with on your platform, so you can kind of explain what you do and try to and give a face to the company so you're not as scary when someone calls. So that's really what, it's like, and I also play guitar, whatever. So, but it's because I think a lot of people are reluctant to call any of you or a lot of the services because they're just afraid. They're afraid they're going to lose some autonomy, or we're going to lose some control, or we're going to, there's a fear factor that's out there, in this whole process. So how would you recommend someone making that call to your front desk? What's that going to be like for them, and how are you going to guide them to make it back? And all of you can answer this, but maximize that experience. So I don't know who wants to start on that one.
I know for me, I take in probably 95% of our calls, and I basically start with learning about them, and I try to meet them where they're at. So, answering their questions. Just yesterday, kind of in the way of what Theresa was talking about, I had something come in where someone was on a neuro patch. They can't afford it. He's having to leave his job because of Parkinson's, and she's having to become the caregiver and go part-time. So their insurance is changing. And because of that, they're not able to use a coupon that they were normally able to use. And so I was able to learn that about them and then ask them to give me a day or so and get back with them. And so I was able to get back with them and let them know, hey, I've talked to the pharmaceutical company. Here are some things that they have in place that can help you. Please contact them, and then I will follow up with them. So whatever it might be that they're looking for, whether it be support, exercise, or education in one area or another, I try to, again, first of all, learn what they're wanting and then meet them where they're at. And then maybe at the tail end of the call, say, hey, these are some other things we offer. If we can be a resource for you in the future, please let us know. That's how I personally, and we personally, just try to, like I said, meet them where they're at first, and then share with them gently all the other things that we can help them with.
Because it's a lot of stuff. You do a lot of things that people don't have a clue that you do. I know, so in those conversations, I'm sure you probably have people that are kind of having these aha moments as that conversation goes on. So.
Yeah, I can say, go ahead, Marie.
Well, I was just going to say that, we just try and message that no question is too big or too small. It doesn't, but as Kim says, conversation, once you start listening, then things come up, and you may start with one thing and you end up the call, actually touching base with several things. But just trying to take, and I also try and encourage people to think, these people are paid to take these calls. That's what they're there for. And we have people working during the night because they want to have those calls. And it doesn't matter whatever it is. And if you need something more locally, our issues are, we have a national helpline. So, it is routed through Chicago, but, if needs be, it can come back down to me at a local level, and, we deal with much more local knowledge about where to go. But yes, just trying to let them know that it's nothing, they've heard it all, and any question, whatever size, is okay.
Yeah, and those are both really good points. I think the only thing I'll add too is just trying to encourage that the sooner you reach out, the better things are going to be 99.95% of the time. It's no different than a cancer diagnosis. If you keep letting it go without intervention, it's only going to get worse. So we try to encourage people, the earlier the better, because if you think this is a problem now, let it manifest, and it's going to be a crisis later. And SACOA, you talk about intimidation. SACOA is so large and complex. Most of the people at SACOA don't fully know what all that SACOA does, right, respectfully, because it is so extensive. But we do find, just make that call. And I think kind of what's been mentioned too, they may be calling for issue A, but if they have issue A, particularly if our population who generally speaking, is very, very vulnerable and sometimes not that financially well off. If they have a problem with A, there's a good likelihood they also have problems with B, C, and D too. And so with that early intervention, we can identify those, address them, put a plan together, and let's keep them from getting into crisis mode. A lot of it too is just it's so complex to navigate the system. People don't know where to begin or where to start. There's misconceptions even about SACOA that you have to be, poor essentially to contact for help. That's not true. You have to be old to do it. That's not true. And so really what we would love to see is get to us early so that we can prevent poverty, so that we can prevent you from spending down everything you have to receive care because you got the intervention a lot earlier. So those would be kind of the things that I would emphasize to anybody willing to listen.
I think that part of it, and I think this is probably all of us, is with every one of you here, your services are there for people. They're and I don't know, there's maybe cost for some things, but you've got a lot of things that are no cost. I think a lot of people are not real sure if free really is free. They're afraid that they're going to get, sucked in, and then it's going to be, all these expenses. And I probably should have had caregiver homes on here, but I met them at SACOA. To the idea that you could, not, and they have to get approved through SACOA for this. I understand that for the Medicaid waiver part of it. But I mean, you could actually have someone support the caregiver, with, a care plan, a nurse on, to help them with things, and pay the caregiver, be it a spouse or what have you. So, so it's anything but going to get into your pocket. You guys have real services available for people, and I think that sometimes people think it's too good to be true, and so they don't look for that or what have you. I mean, you say you Google free health, but do people really believe it's free? There's so many things on the internet, so it's kind of like, I mean, do you guys run into that where you're having people that are kind of sitting there holding back, thinking that you guys have there's another shoe to drop or whatever?
Yes, we had a gentleman that is a patient in one of our medical clinics, and I'm free to talk about him because he has given us permission to do so, but he had a medical crisis and he Googled free healthcare, and he truly did not believe that free healthcare was a thing. And he called the 1-800 number on a whim. And I guess what I was thinking when you guys were talking earlier is trust is hard to win and easy to lose. Mm-hmm. So from the first moment that we communicate with our patients, we have to have that in the back of our mind. And that's kind of been our mantra for the year. Like I said, no dead ends, break down barriers, and fierce advocacy. We have a lot of people that call us because they have a STI and they're in discomfort and they need treatment. And that's a really hard thing to say to somebody on the telephone. But we are, judgment-free zone. And, for us, it's a matter of establishing trust from the first moment that someone picks up the phone and reaches out to contact us. And we work really hard to create a positive experience every single time. And I'll tell one other story because it's a good story too. We just had someone that we were able to treat in one of our clinics for hypertension and pretty bad high blood pressure. And we got her started on some meds, which are also free at our clinics, and had her come back for a 30-day checkup. I think it was 30 days, either 15 or 30 days, I can't remember. But a couple of different individuals on our team followed up with this patient because the team and the doctor was pretty worried about their blood pressure. And she did come back for her follow-up visit, and we did refer her on to a primary care doc. So I don't even know which one, but the point is that when we got the feedback from her, it was that we didn't have our noses up in the air. That's her quote. And I thought that was so interesting. And here's my team living out our, fierce advocacy and no dead ends, no barriers. And she felt comfortable coming to us, and she trusted us enough to go to that primary care doc. And so when I say we have those warm referrals, I mean it. If I'm going to send someone off to a primary care doc, we're going to make sure that they get well cared for. So it's trust, and it's a hard thing to earn and an easy thing to lose. And so I think that's really, really important for all of us, and I love what you said, Kim, about meeting patients where they are. right? Wherever they are, they're all reaching out to us for help for something. And really taking the time to shut your mouth and open your ears and listen is huge. Whether they're calling because they have an STI, or they're calling because they have a new diagnosis, or they're calling because they've lost their insurance, and they need some help. It's hugely important.
If I could piggyback off of that, I think, the shame people feel can be a barrier for calling. So, if someone has an STI, to immediately say, hey, you're not the first person to go through this, and you're not the only person to be going through this. And that goes, with an STI all the way up to hospice, right? I mean, I think healthcare is such a broad spectrum. But people can feel isolated because of a diagnosis, or they can feel isolated because of a condition that they have. And so when they call, one of the first things, we try to do is just validate them and say, you know what, you are not alone in this. You don't have to do this by yourself anymore. We're here to help you. We've helped lots of other people in a very similar condition. And we want to bring you into the circle, and just make you feel like you're supported.
That's excellent. Well, guys, I want to tell you that this one thing too, this video will be shown. We have a pretty big reach. I'm getting people from like Washington, Seattle that are commenting back to things. So we're getting a pretty broad reach now. A lot of people out of state. Parkinson's, there's going to be Parkinson's all over the place. I assume will be a similar name. Alzheimer's, the same story. SACOA, there are different names. How would you kind of give us a tip of what to look for?
Yeah, I think the biggest thing to take away, I mean, if there's people located anywhere in the United States watching this, there is an area agency on aging like a SACOA in every single county in the entire United States, from the furthest point of Alaska to the southern tip of Florida and everywhere in between. So it depends on the state. Some have many, like Indiana has 15. Some may just have one, but just a simple, really my recommendation would just be a simple Google search on area agency on aging in Washington State, or wherever, and those resources will pop up. And then if they want to take a deeper dive, just get in touch with that area agency, and they'll be able to connect you to organizations similar to everybody we have on here today.
Thank you. Kim, would you say the same kind of thing, or?
Yeah, absolutely. There's always the national, which is the bigger conglomerates. But again, there are local agencies for most, diagnosis out there in the state. But we, since the pandemic, obviously so many programs have gone virtual, like exercise programs, support groups. It's almost opened the world a little bit to different opportunities, because we can cross state lines without leaving our house, right? Which has been an amazing opportunity. But I do, people can call me from wherever, and hopefully I can connect them with whatever they need. And if they need help finding that, I will help them do that too. But yeah, sometimes Google can be overwhelming. So a lot of times I will say, hey, would you like me to try to find a phone number or something? Because they don't know, what they don't know, and they don't know, who is a trusted resource and who isn't. So if we can help them locally in that way, hopefully other local agencies in their areas can help them in the same way. So, but again, if somebody calls me from out of state, I'll try to find for them their local agency if that's what they're looking for. But yeah, the local is probably best for everybody, but virtual has been a blessing too.
That's great. Maria, the same story, or?
Well, yeah, we're just so very fortunate to have this national helpline, the sort of 800-272-3900. So that really does help us, connect with people, wherever. I think we've got about 73 chapters across the country. So, and likewise, I was going to say, people could call me, and then I'll do some homework and find out, who they can contact locally. And often we're dealing with families from out of state as well. Their loved one may be here in Indiana, but they live in Texas. So we have the whole thing about providing care from a distance. And so we are very fortunate. And as Kim says, some of the silver lining from COVID is that, because some things have gone virtual, we're now able to tap in to things that are happening in New York. So really, really useful when we're looking at specialist support groups. So if we're dealing with, caregivers who align with the LGBTQ community, we've got some specific groups for them. So, and they may not well be in Indiana, but they may well be in New York City, but we can now share, which is wonderful. So that has made things a bit easier. But yeah, having that national number and a national website, because people can navigate and find local things even just through the website. So yeah, we're very fortunate for that.
Very good. Madison, are you unique unto yourselves, or is there anyone else out there that does these kind of things?
So we are unique to Indiana and to our model and how we operate. However, we are a part of a national group of homes that are similar to ours. So they might have some slight differences, but it is still that free hospice housing model. And so I am connected to that. So if someone is watching from another state, I can certainly reach out to the organization that I'm a part of and say, hey, I have someone here who lives here, and see what I can find.
Perfect. Theresa, what about you? I know you're Marion County, aren't you? Or okay.
Yep, we sure are. And we are, again, intentional about having a network of free clinic referral partners. So our dental clinic, you have to live in Marion County to be able to access the services, because we are in partnership with the Marion County Public Health Department. We've got a whole handful of clinics that we are able to refer people to if they can't meet that criteria. So and medical wise, there's free dental or medical clinic in Hamilton County. And so we do serve the Indianapolis and that, I guess, county areas primarily.
Well, very good. Well, thank you very much for being here. This will be going out. The video will be. My dog's going crazy, so he's trying to talk over me. But thank you guys very much. We'll talk to you soon.
Sounds great. Thank you.
So much.
Bye, y'all.
Thank you.
Thanks so much.
Everybody.